Hello, everyone. This is Dr. Lakita, and you are here at the Mental Health Table Talks once again. This is MHIC-TV1, and we're glad to be here. So we just got finished talking to Dr.Ammar Saheli, who is the author of Eerie Silence, and you must read that book. It's full of information about the social, political, and theological justice, injustice, so that you understand a little bit better how to contextualize conversations that you're having with people around you. But we've invited someone else that we think is just wonderful. We're so grateful to have you. Thank you so much, Crystal. It's so good to have you. So Crystal Hawkins comes to us with a variety of different backgrounds and skills. She is the wonderful founder of her own organization, Criminalization of Learning, and she's going to get a chance to talk about the work that she does in San Francisco. But Crystal, just kind of give my audience a little snippet of where you're from. I'm from Long Beach, you're from LA, but tell your piece about where you're from and give us some insight.
My name is Crystal.
There we go. So my name is Crystal Hawkins, born and raised in South Central LA. Born to a single mother of 5 children. I have 4 older brothers. I wanted to attend a historically black college, university, so I moved to Norfolk, Virginia, where I got my bachelor's and master's in clinical social work at the Norfolk State University. Moved back home in 2014, came up to the Bay for a party, ended up meeting my mentor, who was then the chief of the early education department with San Francisco Unified, where at the end of our conversation that included life at a HBCU, bell hooks, and Beyonce, I was told to send my resume to her. So.
And the rest is history. And because of that move, we get a chance to be enlightened by your life. Myself, having experienced you last year at a Mental Health Matters conference in Berkeley, California, where I was able to be the host. So thank you for being here. So the conversation we were talking about is PTSD and being black. You have been on stage with Dr. Ammar before. So I brought you on because I wanted the world to kind of hear your take about how mental health systems interact with our black babies. And I wanted to just go right into a juggler because I felt something even just saying that. Which is probably why I'm on this side of it, because I want us to teach and to train and to empower people to treat everyone better. Because when you know more, hopefully, you can do more and be more. So tell us.
Well, systemic racism, as Dr. Saheli mentioned, is real, and we see it as early as children 2 years old and 9 months. I do a lot of work in the early education department with children between the ages of 2 years, 9 months, and 5 years old, and what we see is that black boys are criminalized for learning, to where their white peers are given passes or seen as maybe being rambunctious or just curious, to where if a black boy is doing that same behavior, they're criminalized for learning. They're not seen as being a 3-year-old black boy, regardless of size or height, anything like that. They're seen almost as if they're adultified and then penalized. I say often, we don't have books on how to work with white students because, as Dr. Saheli mentioned, white supremacy culture is embedded everywhere, including our institutions, because it's saying working with white students is the standard. But let me write a book on how you work with them black boys or those Latino boys or whomever else. This includes our standardized testing that we start as early as 4-year-olds with our babies. Screenings we use also about things that are culturally appropriate here, some as rhymes, nursery rhymes. All of us don't know these necessarily nursery rhymes, and if you don't get them because they wasn't taught in your household, then you're gonna fail. So we talk about wide misachievement gap that starts in pre-K. We're moving from saying like the pre-K to 3rd grade to saying the age 3 to grade 3. Because as you know, across the country, this pre-K to prison pipeline is real, where prisons are using 3rd grade literacy scores to determine how many beds or prisons to build, because they're saying by the grade of 3rd grade, if you're unable to read, not coming to school, you're gonna fail out, right? So what happens when you fail out of school? It's gonna lead to a life of crime, right? Life of crime will end you in jail. So that is happening as early as 3 years old with our babies. And we talk about this significant disproportionality where Black boys are overrepresented in special education for emotional disturbances, which I like to say lack of classroom management, particularly when they don't have teachers that look like them, okay? So what that's happening is you're setting them up to fail. California ranks #1 in the United States for being significantly disproportionate. Within California, San Francisco, that has many resources, ranks #1 in the state of California.
So, with that kind of information, Crystal, and you can also chime in too, Dr. Ammar, being the Director of Student Services in San Lorenzo Unified School District. So, how do we help clinicians and psychologists and people that have to see these babies? How do we help them become mentally fit, or how do we even help gauge where they are mentally? What is a step that has to be done? If we've got this kind of narrative on the backdrop about criminalization on their learning levels and the behavioral aspects of maybe they didn't even eat, maybe they didn't have food. I mean, when I grew up, and thank God I grew up. Mary Kay Thomas, aka you, my mentor from kindergarten up to junior high school. Anything going on in my life, she didn't send me to the office. Now, I don't know if that's because she too is Black, but there was a standard of questioning. Did you eat breakfast? Well, look, that's why you're not all over the place. You got to eat. Your mama she probably told you to go eat. You probably was outside playing. But there was a different level of questioning that they had that today we don't have it. So what do we start to do with the mental health? How do we help those that are in mental health help our babies?
I think one of the main issues is that our Black babies aren't seen as babies. I think it's that you're 3 years old, we don't know the backstory that you didn't eat, your only meal may come at school, so you're having a tough time, you're seen as this 7, 8, 10-year-old boy being aggressive or violent for something that, again, their peers are not being penalized or criminalized for. So I often struggle with that because to do this work with Black children and families, it's also hard in San Francisco doing this work as a Black clinician. People don't recognize you as a Black clinician as being an expert in your field. I often say I walk into meetings sitting on ready, I'm that person. But also, you don't see all these great letters behind my name and expertise because I'm small in stature. It's like, who's the little Black feisty chick? It's more so that when I come in and we have this conversation, it's like, oh, okay, she knows what she's talking about. Not that I was even invited to the meeting, it's that I have to give it to you like I'm from 107th Street in Los Angeles.
So what would you like to say anything to that, Dr. Saheli?
I mean, I echo all of those saying